Hi, Assalamu alaikum and good day to Madam Najwa. So today my group and I will elaborate and present on the bandaging skills for Project 1. This is our group presenters, which is Dashwini Sri, Saranya Nair, and myself, Siti Nur Aisha Shachida. So let's look at the content. In today's presentation, we will talk about the introduction to bandaging skills, and then the three types of bandaging skills that we have chosen, which is wrist, ankle, and elbow. There are three types of bandaging, and it is wrist, ankle, and elbow. We will start with wrist bandaging, moving to ankle, then ending with elbow bandaging. In all of the three bandaging skills, we will focus on the introducing and details of the bandaging skills, following with explanation of the usage of bandaging skills, the steps on how to perform it properly, and an explanation on the supporting equipment involved. Moving on to the first bandaging skill. This is wrist bandaging skill. So in short, bandaging is a type of compression. However, compression bandage is different from the common bandaging. Compression bandaging is where medical professional would bandage the severe parts of the body tightly due to body deformity and so on. However, bandaging in the common context would be a support to aid temporarily before seeking medical help. Where do the bandage cover? The bandage cover entirely from the MCP to the CMC and the radiocarpal joint. So let's talk a bit about the history. According to Meritod, the bandaging has been done back in the Egyptian days. It is used to treat wounds and sprains and strains. However, the bandage is soaked in herbal preparations beforehand. So, what is the benefit? It is to provide support and to restrict the movement before a certain treatment. Hazard in wrist bandage is that it might cause pain and worsen the affected area. Blood circulation might also get cut off due to this. Moving on to the use of bandage. The use of bandage of wrist bandaging have many objectives. The first one is to exert pressure. This is because it is to reduce or prevent swelling or sprains that could worsen the injury. The second would be to provide support. The support which would help ease the pain from worsen in the affected area. And then the third is to correct deformity. To correct deformity means the medical professional have to compress tightly to reshape the skin and flesh structure. This only happens commonly in very severe cases. And number four, which is to restrict movement. This is because it would heal faster and to prevent from worsen the injury by moving around and flicking the wrist and the hands and fingers that would injure the part in between from the palm and the wrist even more. Number five is the right amount of layers in bandaging. So as Nelson 1997 have said, that 2 layers of bandage exert twice the amount of 1 layer, meaning that depends on the injury. Some injury requires more layers, some require less layers. More layers might not treat the injury better than less layers. More might be a hazard, hence trainers must be aware of this, of the structure and the analysis of the pain that causes from the patient. This is the steps on preparing the wrist bandage. The first step is to identify the pain and detect where the location of the pain. The second step is to start wrapping from in between the thumb and the index finger. Then moving on to the wrist for 2 layers before moving back to the palm and vice versa. Once the bandage is done properly and have been secured with the bandage clip, check the blood circulation of the bandage area to see whether the bandage is not too tight, which might cause more harm than good. This is what a proper wrist bandage looks like. We have 3 pictures from the top, the bottom, and the side. These are the supporting equipments in the bandage: cotton wool, wrist splints, and different types of bandages for different injuries. As written, that the current wrist splint is very much convenient for sore, pressured palm and wrist. As for the cotton wool, it is used to absorb moisture from wearing the bandages too long or the patient with uncontrollable sweat. It also deems as to be an extra support for abrasive wounds. The 3 types of bandages here are cotton wool, non-woven, and gauze roll. So as for the cotton roll, which you will see in the next video, next slide of the video, it has less pressure and it is perfectly suitable for sprained or strained areas. As for the non-woven, it provides more pressure, so it is more on the intermediate level of pain. The gauze roll, however, is for treatment dressing, which is to hold a certain ointment or apply topical medication. So moving on to the next video. Hi, today I'll demonstrate to you on the wrist bandaging skill. The first step is to analyze and identify the problem of the affected area. Starts by pressing the palm to check where the affected area is. So do you feel any pain here?
Yes.
Could you describe the pain? Is it sore or a throbbing feeling?
Sore.
It's sore. Alright, so the soreness is in between the radiocarpal joint and the carpal metacarpal joint. So assumptions can be made that the ligaments in between are the affected in this case. So since we now have known where the affected area is located, we can proceed with the bandaging. The proper way to do this is to start with the in between the thumb and the index finger. So like this. And then wrap the palm in the back of the hand, but proceed to the wrist immediately. And then make sure to wrap the wrist twice before going back to the back of the hand and then back to the palm. So wrap it once and then go back to the wrist and cover that part, and then wrap once, go back to the palm, wrap again, make sure the bandage is not too tight but is snug enough for the patient and the host. Then you may cut the bandage if necessary. However, if it is not necessary, you can use the whole roll of the bandage. So make sure it is nice and snug. Make sure the patient can move their fingers, but also restrict the movement here from the wrist to the palm. And now let's secure it with the bandage clippers. So now the bandage is nice and secure. Last but not least, check the blood circulation to see if the blood is flowing. Because if the blood circulation is stuck, which can cause to more damage to the affected area. Thank you.
I am Saranya, and now I'll be presenting on the next bandaging skill, which is the ankle bandage. So, an ankle bandage is done when a person experiences a sprained ankle and is in need of some comfort or pain relief. So, an ankle bandage is also known as a compression wrap, which could prevent the swelling and it could also limit the movement of the injured ankle. So, we should also remember that a sprained ankle, it could feel better with an ankle bandage. It would not limit entire movement, but it would remind the athlete or the person experiencing the sprain to avoid moving too much. All right. So the ankle sprain is a phenomenon of which the stretching or tearing of ligaments is occurring. So as you can see in the picture here, there is three types of legs showing the ankle. So the one on the left side is the lateral side of the ankle. The one in the middle is a normal foot, and the one on the right hand side shows the medial side of an ankle. So sprains usually occur very well or very often in the lateral side compared to the medial side of the ankle, because the ligaments on the lateral side of the ankle is weaker compared to the ones on the medial side. So it is really rare for a person to have a medial ankle sprain, but it is very, very common for a person to experience a lateral ankle sprain. I will now present on the type of bandaging skill that I had used. So, as we know, in bandaging itself, there are various types of skills and also methods. And in bandaging itself, it does not only provide ease to the patient, hence, it is also very convenient for the treatment provider itself. So, usually, ankle bandages they are made out of elastic material so that it can be stretchable, and it is also very easily slipped on. And many years back in the earlier days, ankle bandages or any type of bandages were made out of heavy canvas materials, which were not very comfortable. But these days, the materials used are synthetic materials, which are very comfortable for the patients to use and also very easy to be used by the treatment provider. So, the skill that I have applied for my ankle bandaging is the figure eight skill. Okay, so the figure eight skill is a style used in a way which involves two turns of the bandage interlocking, or you can even say overlapping like that. Okay, each other at the side where the joints are either being flexed or extended. So this would give the patient some tension near their ankle, which would also give them relief. Okay, so this is usually done for binding a flexing joint or a part of the body which is either above or below the joint. So now, like for instance, as I mentioned earlier, for a lateral ankle injury, what would happen is the bandage would be placed from the lateral side and then moved around towards the medial side. And if it's a medial ankle sprain, then it would be vice versa. So the figure eight step is used to cover the entire foot. So when you use the figure eight step, the whole foot is covered. So this would create a tension on the joints and making the patient feel some relief. Before beginning the procedure, it is important to ask the patient on how they are feeling and getting some background information about the injury. After that, the first step of the bandaging skill is to make sure that the bandage is first rolled up. So if it's not rolled up, then we should roll it up and then set the foot at 90 degrees. Hold up the ankle, and from the lateral side, Since I'm focusing on lateral side of ankle injury, so I'll be explaining on lateral side. So we start from the lateral side and then hold on to the loose end and bring it around the medial side of the foot. So we just continue wrapping until we have reached the heel of the foot. For the second step, we have to use the figure 8 motion. So as we use the figure 8 motion, we have to go up around the arch of the foot. Okay, the rotation should go from the heel of the foot up to the ankle. Once the bandage has reached the ankle, the bandage should be wrapped around the felt piece in order for it to stay in place under the ankle bone. The third step would be to use the figure 8 motion moving towards the patient's calf. Then we have to ensure that the bandage has covered the entire foot and at least 7 meters above the ankle. So the final step would be to make sure that the entire foot and is covered, and then we have to secure the bandage using a tape or a bandage clip to fasten the bandage. So if we don't have a bandage clip, we can even use a safety pin. But when we're using a safety pin, it's important to remember that we do not injure the patient. So that's all for the steps. As you can see here, this is a lateral injury of the ankle. So in the first step, the bandage has been already wrapped around the arch of the foot. All right, you from the lateral side up to the medial side. In the second step, the figure 8 motion is used to go around the ankle and the arrow points at the heel of the foot. So this is the procedure where you have to cover up to the arch, to the heel and all the way up to the ankle. And then in the third step, the figure 8 motion is continued up to the ankle and moving above towards the calf. And the final step is ensuring that the entire foot is covered and it is secured. The bandage is secured with a bandage clip, tape, or safety pin. There are many types of bandages out there which have various uses and functions. So the three most major ones are called the roller bandages, tubular bandages, and triangular bandages. So to begin with, the roller bandage is used for sprains or strains. It is a long strip of elastic material. The roller bandage is used when a person experiences a type of sprain. So the roller bandage is made out of materials such as linen, cotton, or any other synthetic material. And this can also work as a compression. Moving on, the tubular bandage. So the tubular bandage is usually used for fingers or toes because fingers or toes are very difficult to be bandaged using a gauze. So it is used as a support for keeping dressings in place on parts of the body, which includes lots of movements such as the elbow and the knee. And finally, the triangular bandage. So the triangular bandage is made out of cotton or paper that is disposable. So this bandage is usually used as a sling for arm in order to support or immobilize the upper limbs. So the triangular bandage can also be used as a temporary treatment for a broken bone or strain for protecting the limb after a surgery. So for our skill, which is the ankle bandaging skill, the type of bandage that we will be using is the roller bandage. So the roller bandage is the most suitable as it is used for compressing the sprained part of the body. Moreover, it is elastic, which would work better as it would stay in place and hold firmly, in which it would give better compression of the ankle and also ease and convenience of the treatment provider to make sure that they have covered the entire part of the injury. Hi, my name is Saranya and today I'll be presenting on how to do an ankle bandage using an elastic bandage. So right now my patient here is having an ankle sprain So before any procedure, it's important to ask your patient on how they are doing, how much is the pain. So I'm going to ask my patient now. Okay, does it hurt this side or this side?
That side.
This side. Okay, in a scale of 1 to 10, what's your pain level?
6 out of 10.
Okay, 6. So the patient has just mentioned that she's having her pain over here, which is the lateral side of the ankle. So usually ankle sprains occur more often on the lateral side compared to the medial side, because the medial side ligaments are stronger compared to the lateral side medial. Alright, so now I'm going to start. I will start from the lateral side, and then I will bring it bottom to the medial side, and I will tighten, make sure there's a grip there. So why I'm doing this anchor here is to give tension to the ankle. Now I'm going to slowly move upwards, and I'm going to go in an 8 motion. So I have to make sure that I'm covering her entire foot. So I'm going to follow the same motion, which is a number 8 motion, all the way up to the top. I'm going to do the same thing. So we can do this until the bandage reaches the top around the calf area. Okay, and then we can secure it with a pin or a bandage clip. So if you don't have a proper bandage clip, you can use a pin. So right now I'll be using a safety pin. So when we are using the safety pin, it's very important to ensure that we do not injure the patient. So now I'm using the safety pin to secure the bandage. Now after that, I'm going to ask her to flex her ankle a little. Could you please flex your ankle? Okay, how does it feel?
Better.
Better. Alright, so after that, we have to ensure that there is blood circulation. So for that, we can check at the back of the toes. So as you can see, it isn't pale. So if it isn't pale, it means there is blood circulation. And this is only a temporary secure bandage. So for further treatment, she can go to the hospital. So that's all from me. Thank you.
Hi everyone, I'm Dashwini Sri and I will be talking about the elbow bandaging skill. So the elbow bandaging is done when there is a strain or sprain in your elbow. A sprain or a strain occurs when the ligament that supports your elbow is bent or twisted in a forceful manner, unnaturally or carelessly. Okay, this usually happens when you are playing sports like tennis, or when you overuse your elbow. You use it more than its capacity. So that is when you will have a sprain or a strain or an elbow injury. So moving on to the next slide. In this slide, I will be explaining more about the bandaging skill that is chosen. So first, the bandaging technique that I have chosen is the figure 8 bandaging technique, and this is to stabilize the elbow joints and also to support the soft tissue injuries. So in case you have a sprain or a strain, this bandaging technique is recommended. So what can an elbow bandage do? An elbow bandage can reduce pain, can reduce swelling, and also restrict movements. So, in case you have an injury in your elbow, or you have a sprain or a strain, you are not allowed to use your elbow too much, or you are not allowed to use your hands too much. So, in order to restrict movements, this bandaging technique is recommended. So, moving on to the next slide. So these are the steps on how to bandage your elbow. So step one is to place the tail of the bandage on the inside of your arm, if you can see the picture, and wrap it around your arm twice. It all depends on your bandage size. If your bandage is very long, then you can go 2 or 3 rounds. If your bandage is a short one, then it depends on the round. Like let's say you can go 1 round also, if your bandage is short. And make sure your bandage is not too tight and not too loose. Okay, because if it's too tight, then it's going to restrict blood circulation. So step 2 is to wrap upwards, bringing the bandage diagonally from the elbow towards the bicep. Okay, if you can see, you have to start once and then bring it up. Okay, step 3 is to wrap figure 8 when you reach the elbow. Wrap a figure 8 pattern around the elbow. So you just have to follow the figure 8 pattern, which looks like a crisscross. Okay, and step 4 is to finish the bandage when you reach the bicep. Finish the bandage by completing two turns directly over one another. Okay, over one another. Step 5, step 5 is to use the binding clip or the bandage clip in order to secure the bandaging. Just put it up and just press on it. So the moment you press on it, it will hold the bandage tight. If you don't have the bandage pin or the binding clip, you can use safety pins. Okay, so moving on to the next slide. So the supporting equipments needed in order to do an elbow bandage is a roller bandage, a triangular bandage, and a bandage clip. So a roller bandage is used to bandage your elbow to make sure it reduces the pain and restricts movement. In case you don't have a roller bandage, then you can use a triangular bandage. It is also used to compress or to reduce the pain and to restrict movements. But in case you don't have a roller bandage, then you can use a triangular bandage. And in order to keep the bandage in place, you have to use bandage clips, which is more safe to use. But in case you don't have a bandage clip or you are in a rush to get a bandage clip or anything, then you can use safety pins. Small safety pins would manage to keep the roller bandage in place so that it doesn't move or it doesn't get loose. So the following video will show you how to bandage your elbow in a proper way. So that's all for me. Thank you. I'm Dashwini. So I'll be showing you how to do an elbow bandage. So this is my patient. She has an elbow sprain. So I'll show you how to do the bandaging. The first step is to ask the patient whether they are fine, are they having a lot of pain, or do they want something to drink, and what is their pain level, their scale of pain. Okay, so the first thing that you have to do is to make sure the elbow part, the joint here is slightly bent like this. Okay, so you can see, go 1 or 2 rounds depending on your bandage size, and then move up, move down again, and then up again. Okay, continue this technique till your bandage finishes. So this is called the figure 8 bandaging skill or technique. So if you can see, there's this zigzag pattern here. Follow this pattern till your bandage finishes. Okay, and then use this pin to secure it. Okay, see, if you can see, this is how you have to do it. Okay, it's a very easy technique. So that's all from me. Thank you. Okay, so in conclusion, through this project, we learned how to do proper bandaging and we learned new bandaging techniques. We learned to use correct equipments for each and every injury, or how to use correct proper bandages for each and every injuries. So we would like to thank our lecturer for giving us an opportunity to learn about the bandaging techniques. It was a new experience for us, and surely this will help us in future. So thank you for listening. That's all from us. Thank you.